Introduction. Welcome to HeInfo channel. Feeling overwhelmed by worry or fear? Anxiety disorders can disrupt your life, but understanding them is the first step toward taking control. Let's dive into the treatments that can help you reclaim your peace of mind. The antidepressant widely prescribed for anxiety, Zoloft. What is Zoloft? Zoloft is a brand name for the antidepressant sertraline. Zoloft is available as an oral tablet and an oral liquid solution. Zoloft oral tablets come in 3 strengths, 25 mg, mg, 50 mg, and 100 mg. Zoloft oral solution comes in 1 strength, 20 mg per milliliter, mg, ml. This video discusses how Zoloft works and what you should know before taking it. It also covers potential side effects, interactions, withdrawal symptoms, and other medications you might consider. How it works. Much like a skilled craftsman understands the tools of their trade, let's explore how this medicine interacts with the body. Zoloft contains the active substance sertraline. Sertraline is a selective serotonin reuptake inhibitor, SSRI. It works by preventing the neurotransmitter serotonin from being taken back up into nerve cells in the brain and spinal cord. Neurotransmitters are chemicals that transfer chemical signals from one nerve cell to another. Low levels of serotonin in the central nervous system may be associated with depression or anxiety. Uses and indications. Now that we've laid the groundwork, let's explore the practical landscape of this medication's use. Zoloft is a selective serotonin reuptake inhibitor, SSRI, indicated for the treatment of major depressive disorder, MDD, obsessive-compulsive disorder, OCD, a mental health condition that causes unwanted repeated thoughts or obsessions, and routines or repetitive behaviors, compulsions, related to these thoughts. Panic disorder, PD, a condition where you have frequent and unexpected panic attacks. Post-traumatic stress disorder, PTSD, a condition that may develop after witnessing or experiencing a terrifying event. Social anxiety disorder, SAD, a condition where you have fear and anxiety about social situations. Premenstrual dysphoric disorder, PMDD, a condition similar to premenstrual syndrome, but more serious. Dosage and administration. Zoloft is available in 25, 50, and 100 mg tablets and a 20 mg, ml oral solution. People taking this drug should check their prescription and consult their health care provider to make sure they're taking the correct dose. For people with social anxiety disorder, a typical dosage of Zoloft starts at 25 mg, with an increase to 50 mg after 1 week. Weekly increases up to a maximum dose of 200 mg are permitted for patients who do not respond to lower doses. Generally, Zoloft is taken once daily, with or without food, within the following guidelines. Swallow the tablets whole, not chewed or crushed. If taking the liquid form, combine the prescribed amount of medication with 1/2 cup of liquid, water, ginger ale, lemon-lime soda, lemonade, or orange juice. Prepare each dose immediately before taking it, not in advance. If a daily dose is forgotten, take it once remembered. However, if it is close to the time of the next dose, skip the missed dose and take it at the regular time. Never take 2 doses of Zoloft at the same time. When traveling, store Zoloft in a carry-on bag in case checked luggage gets lost. It's important for people to continue taking Zoloft as long as a care provider instructs, even if they start to feel better. Abruptly stopping Zoloft can lead to sertraline withdrawal symptoms such as nausea, tremors, lightheadedness, muscle pains, weakness, insomnia, and anxiety. Side effects and precautions. Moving forward, let's discuss the potential side effects and how to minimize risks. The most common side effects of sertraline are listed below. Tell your healthcare provider if you have any of these side effects that bother you. Nausea, appetite loss, diarrhea, indigestion, increased sweating, shaking, tremor, agitation, change in sleep habits, including sleepiness or trouble sleeping, sexual problems, including decreased sex drive or ejaculation failure, tiredness, anxiety. The most common side effects of sertraline in children or adolescents include the following: unusual increase in muscle movements or agitation, nosebleeds, peeing more often, aggression, possible slower growth rate and weight change. While less common, the most serious side effects of sertraline are described below, along with what to do if they happen. Suicidal thoughts or actions. Sertraline or other antidepressants may increase the risk of suicidal thoughts or actions in a small number of children, teenagers, or young adults in the first few months of taking the medicine, or when the dose is changed. Depression or other serious mental health conditions are the most important causes of suicidal thoughts or actions. Serotonin syndrome. Serotonin syndrome is when there is too much of a substance called serotonin in your body. Sertraline can cause serotonin syndrome when it is taken alone or with other medicines that affect serotonin. This condition can be life-threatening. Severe allergic reactions. Sertraline may cause allergic reactions, which can be serious. Stop using sertraline and get help right away if you have any of the following symptoms of a serious allergic reaction. Conclusion. Sertraline, Zoloft, is a selective serotonin uptake inhibitor, SSRI. It's used to treat different mental health conditions, including depression and certain types of anxiety disorder, such as panic disorder. It's typically taken by mouth once per day. This medication is available as both a tablet and liquid. Common side effects of sertraline, Zoloft, include nausea, diarrhea, and dry mouth. It's best to avoid alcohol while taking sertraline, Zoloft, because this combination can worsen side effects of sertraline, Zoloft. Here are some frequently asked questions about sertraline, Zoloft. How long does sertraline, Zoloft, take to work? How long it takes for sertraline, Zoloft, to work might differ depending on your medical condition. For example, if you're being treated for depression, you might notice improvements to your mood 2 weeks after you start taking sertraline, Zoloft. But it can take about 1 to 2 months before you feel its full effects. You might feel certain side effects of sertraline, Zoloft, such as nausea and diarrhea, before noticing improvement in your mental health. Talk with your healthcare team if you're not sure if sertraline, Zoloft, is working. Does sertraline, Zoloft, cause weight gain? Yes, it's possible to gain weight from taking sertraline, Zoloft. But sertraline, Zoloft, is less likely to cause weight gain compared to some other SSRIs, such as paroxetine, Paxil. During clinical studies, some people reported weight loss instead after starting sertraline, Zoloft. Talk with your provider if you're experiencing unexpected weight changes after starting this medication. When should you increase your Zoloft dosage for anxiety? Care provider is likely to increase a patient's Zoloft dosage if their anxiety symptoms fail to improve within the first few weeks of beginning treatment with the drug. How long until sertraline, Zoloft, side effects go away? Many side effects from sertraline, Zoloft, such as nausea or sleeping problems, can get better over time. You're more likely to get side effects when first starting the medication and with dose changes. If any side effects become too bothersome for you, let your psychiatrist know. They might adjust your sertraline, Zoloft, dose or recommend certain tips to manage side effects. Thank you for watching. We hope this video about Zoloft has been helpful and answered your questions about depression and anxiety treatments. If you enjoyed this content, please give it a share it with someone who might benefit, and don't forget to subscribe to HeInfo for more clear and reliable medication guides. Coming up next, Lexapro Medicine Explained. Stay tuned for another deep dive into how it works, its uses, and key precautions. Got more questions or suggestions? Drop them in the comments below, and we'll feature them in our future Q&A.